So one of the things that I did when I was in my executive role at HCA was I oversaw the development of psychiatric residency programs around the country. There's a shortage of psychiatrists and a shortage of addiction medicine specialists nationwide. And so we took it upon ourselves to start a fellowship here through my connections with the folks at HCA, and we're doing a joint program with Brandon Regional Hospital here in Brandon, Florida, and River Oaks Treatment Center.
Fellowship is a name we use in medicine for a training program that typically comes some point after doing your residency training. All physicians go to medical school, and there's two different types, allopathic and osteopathic medical schools. But when you get out of medical school, you're trained to be a doctor, you have a basic skill set, but you're not specialized in any particular field. As I stated earlier, did a residency in general surgery to become specialized as a surgeon. If you decide to further your training and either go into a greater subspecialty or in fact move into a different field, you then do an additional training program of variable length, and that's called a fellowship.
This is our first year of this fellowship program. We're trying to follow the guidelines of other programs. So right now we are trying to get them the basic knowledge of addiction. They basically see patients, new patients that come in, they do their histories and physicals and their addiction assessment and create their own plan of action of what to do with the clients. And then they follow them through the different levels of care from detoxification all the way to the outpatient level.
For us as fellows, as new fellows, learning the industry in the field, it's a chance for us to get caught up on just everything that addiction medicine has to offer, right? And so it's part of our training. It helps us along the way, and it gives us a good foundation.
Well, we get the benefit at River Oaks of furthering our teaching mission. We have been a teaching facility with nurses mostly up until this point, and now we're taking physicians from various specialties and helping them really take in the entire care continuum for addiction medicine. Unfortunately, doctors don't learn enough about addiction when they are in medical school and in training. They encounter the aftermath of addiction in the clinics, in emergency rooms, but they often don't learn how to diagnose it properly, how to treat it, and that's what we are bringing here at River Oaks and at Brandon Regional Hospital. We're trying to get doctors to a new place in terms of understanding how to assess this illness and how to treat it for the long run.
To have an opportunity to further my training and in a field like this, it adds to the passion.
To use my experience and my training here at this facility to help people see and gain insight into what they're doing is something that I'm just very passionate about.